I'm Wendy Wilson, and I'd like to welcome you to a special edition of Realizing Potential. Today's show is entitled Intersection of Food Insecurities and Health Disparities Impacting Local and Global Communities, a very relevant and timely topic. And so what I decided to do was convene some our local and across the nation experts. Very fortunate that they all have a connection to Albany State University. And so with me today, I have Dr. Veronica Adams Cooper. She is a professor here at Albany State University. I have Miss Danielle Towns. She's a former employee, but still making an impact here in throughout Southwest Georgia, throughout the country, and then an alum of Albany State University who is working at Weill Cornell. She is Dr. Melissa Davis. Ladies, thank you so much for joining me today.
Thank you.
I want to share with our viewers just the way that you have been able to make such a huge difference throughout your profession, whatever your chosen industry that you serve in. And so I'm going to read your bios because I think that's important so that we get a gauge as to, or they have a better understanding of why you are such phenomenal women and making such a great impact. Dr. Veronica Adams Cooper is a professor here at Albany State University, and she serves in the public administration realm. She serves as the director of the Lois B. Hollis Center for Social Equity, the public service unit for the MPA program here. In her role with the center, she's currently serving as a co-project director with the project director, Ms. Joanna Davis, and also working with the ASU Center for Excellence for Community Engagement, for ASU partnership with the Food Security Initiative for the city of Albany, Georgia, here in Albany, Georgia, which includes the Georgia Institute of Technology with support from ESRI and participation with various community stake group holders. Again, welcome, Dr. Veronica Adams Cooper. Next guest I have is Danielle Towns, currently serves as the manager of business development and partnerships for the National Math and Science Initiative. She received her Bachelor of Science in Biology from Clark Atlanta University and a master's degree in management from Troy University. Over the last 15 years, Danielle has been a force in STEM education through her work with the K-12 systems, institutions of higher education, national youth-serving nonprofits, and has been an advocate who has championed for access and equity in STEM education for all students, especially those furthest from opportunity. And then last but certainly not least, we have Dr. Melissa Davis. She is currently working on how genetic ancestry impacts tumor, immunological microenvironments in breast, prostate, and gynecological cancers. She's an alum of Albany State University, I know, and the University of Georgia, and is a researcher and faculty member at Weill Cornell Medical College Department of Surgery. Welcome again, ladies. So glad to have you.
Yes, thank you for inviting me.
My pleasure, my pleasure. We're going to start, again, just trying to set the foundation for this conversation. And as I started off, as our viewers well know, particularly those that reside in this particular Southwest Georgia community, one of the highest poorest congressional districts in the country, which then has a ripple effect. And so where you have grave or significant poverty levels, that means it's unemployment, that means there's an inability to provide as you desire for your household, which impacts just the basic necessities. So housing insecurity, but our focus today, of course, is food insecurity and what that means. So not being able to feed your family. And even if you are able, depending upon the location in which you reside, you may not have access to healthy food options. So the issues and the matters become that much more exacerbated. And so it's a significant problem, which is of concern. It affects our students here at Albany State University. And so we are working to develop and expand our food pantry because we have students who are also challenged with that. So let me begin with you, Dr. Adams Cooper. You have worked very committedly to trying to address the problem as it relates to just conducting some research. But before you kind of share with our viewers what your work entails in that area, will you give us just a broad definition of what food insecurity means?
Thank you, Dr. Wilson. And basically, you've already shared food insecurity deals with the lack of regular access to healthy, nutritional food items for a household. And there are four levels of food security, meaning you have access to healthy and nutritious food. So we have high, we have very high, high, we have low and very low. And certainly in Southwest Georgia, we fall within the category mostly of low.
I understand. And so let's talk about those food options, which are very concerning. I was doing a little research the other day, and so we have the smaller grocers are saying that they can't remain viable or exist because of the larger box grocers, if you will. So the Walmarts, and I know the Dollar Generals, and I can't think of the other outfit, are also incorporating a grocer section in there. So there's that competition piece. But even with those that are remaining, as you mentioned earlier, the food options are so poor. So they're either high in salt, high in sugar content, which then let's transition over to you, Dr. Davis. How does that affect our overall health? So we can be very critical of communities, high obesity rates, high incidence of blood pressure, diabetes, just a myriad of health issues. But the direct link is what we eat.
Absolutely. So, I mean, data shows, for instance, in cancer research that, in a lot of research, that comorbidities such as diabetes, obesity, hypertension, all of those things, cancer, are linked to food insecurity, given that what we eat can impact the biology and physiology of our bodies. So for instance, in my work, we study how the immune system responds to cancer. Well, your immune system, and the status of your immune system is directly related to your obesity and whether or not your diabetes are controlled. And so when you think about trying to follow guidelines, we can publish all day long and all year long about trends in healthy eating and what you should eat, but do you have access to that? And I think in the minority community, especially all across the country, every city that I've ever lived in, there's going to be a component of the community that exists at a poverty level where their security in accessing food is, in some instances, not even present. So for instance, outside of Chicago. And when we look at those populations, those are also the same populations that have the most aggressive forms of cancer and or are not responding to treatment well, even when they get access, okay? Because there are multiple layers of disparities and social determinants that impact whether or not a patient is going to have a better chance of surviving a cancer diagnosis. But directly, we know, like, the molecules, down to the molecules of what is in preservatives, what is in high fructose corn syrup. We know the molecular pathways, right? So the genes that are impacted by those molecules in your body, because your body doesn't recognize those as natural compounds and how to handle them. And we know that those are the things that drive a tumor's sort of aggressiveness, right? And so for me, this is a very important question because, I'm not a clinician, but I would like to tell my community, these are the things that we see in our laboratory results. And I'm pretty sure, if we were able to make some changes in our lifestyle, that we would move the needle backwards. And instead of seeing more death from cancer, we would see better outcomes.
Very good. Thank you for sharing this. I'd like Ms. Towns for you to weigh in, and Dr. Veronica Adams Cooper, you as well. And I want to stay on script, but when you were giving the example, Dr. Davis, about the high incident or the aggressiveness on the south side of Chicago, I immediately went into also, so we're of course talking about the impact of diet and the foods that we eat and the ill effects of that. But I'm also then, what popped in my mind are just the everyday stressors of life.
Mm-hmm.
And so again, back to that, the poverty level and then what that all entails. So I'm originally from Detroit, so a neighbor of
Mm-hmm.
Chicago. So I'm thinking
Mm-hmm.
about the weather. If you have housing insecurity, if you're unemployed, all of those things create a perfect storm and impact your health. Yeah. So it's in addition
Absolutely.
to the food options. And so then you're saying, now then imagine having a diagnosis and then trying to just journey through that path with all of
Exactly.
these other variables in impacting your health. Ladies, feel free to weigh in on that. And then Ms. Towns, when you weigh in, would you also then include what your background as it relates to the STEM disciplines and how they factor into our conversation today?
Absolutely.
We'll start with you.
Sure. So STEM education at its core is a workforce solution, which can ultimately change the trajectory of a student's academic experience, but also lead to improved health outcomes. With STEM education, we embrace a cradle to career concept. So we start as early as 3 throughout the course of high school and also through post-secondary to engage them in not only the STEM disciplines, but in developing these 21st century skills that set them up for success at the post-secondary level and also make them competitive entrants into a global marketplace. So as it relates to these 21st century skills, when we are implementing STEM programming, along with the science, the technology, the engineering, the mathematics, we are working to develop students' critical thinking and reasoning skills. We are helping to shape them as contributing members of a collaborative who, through intro to design thinking and theory, can unlock creativity and spark innovation. So we know those things, in addition to setting them up for success at a post-secondary institution, also set them up to be successful if they choose to pursue career in these STEM industries. Both approaches really unlock and increase a student's, or at that point an adult's, earning potential. When we have this increased earning potential, as we stated earlier, they're able to put more food on the table to reduce food insecurity. They are able to have access to communities that are safer, where individuals aren't engaging in risky health behaviors, or there are more options for local grocers, farmers markets, more options for healthier foods. They are able to engage in a lifestyle that is healthier just by means of access. That higher income may allow them a gym membership, may allow them to get a Peloton. They may be salaried or have some flexible schedule where they can take a jog in the middle of the day. So all of those things that the higher income provides through the exposure to STEM education and hopefully the pursuit of post-secondary education or entrance into the STEM industry lead to these improved health outcomes.
Very good. Dr. Adams Cooper, if you could weigh in, and then also share, you've done some research and in terms of the grocers and the challenges they were having in Southwest Georgia neighborhoods in a particular area. Some of the challenges that you all have identified or did identify in that research, and then some possible next steps.
Thank you. And I would like to say, just listening to my co-peers here and you, what we can understand is that this is a complex interactional situation where persons who have low income and low progression to get out of those income levels will experience a lifetime of poor health quality and just overall poor quality of life. As it relates to Albany, Georgia, and Dougherty County, in terms of the recent work that the City of Albany has initiated through its food security initiative, what we primarily were doing is documenting what the street committee has said in Albany. We don't have access to quality grocery stores in South Albany and East Albany. And currently we have, and you spoke about the big box grocery stores in Northwest Albany, where income levels are highest. You have the majority of the grocers that provide the highest quality of food, the highest variety of food. So you'll have Publix, you have Walmart, you'll have Harvey's supermarket, and you also have some of the neighborhood Walmart stores. And then what we have in East Albany is one Walmart and one Walmart neighborhood. And so it leaves people with the least opportunity for regular transportation, meaning a car or walking to get to those areas. And then it also leaves people who are trapped in their neighborhoods with the option of going to a gas station or going to a convenience store and listening to Dr. Davis and all of those high fructose products that's there for them, the donuts and the cupcakes and the hot dogs with a high content of fat and whatever else in their salt. It hurts the human spirit to do this research because it's not about numbers, it's about everyday people having this as their only option.
That's right.
And what do we do from the research? Well, prior to the research, I'd like to share that you've had organizations working toward food disparity already. We have Southwest Georgia Project for Education that's led by Mrs. Shirley Sherrod that has been working with farmers, family farmers in Southwest Georgia for the past decade or so, trying to bring their products into a higher market. And they've been trying to get a food hub in the old Winn-Dixie that's on Oak Ridge in South Albany. We also had we have a husband and wife team, Mr. and Mrs. Terrell, who started a Better Way Grocers mobile grocery market that is making stops in several of the neighborhoods that are challenged by food access. And we're hoping that they will continue to expand. So in addition to what the city of Albany is doing, we have I think it's the procurement department had a recent RFP, request for proposal, for a grocery store to come into South Albany. So we have a variety of actions that are happening. And lastly, I want to share, out of the City of Albany initiative, we have Southwest Georgia Rising, Sowega Rising, led by Ms. Sherelle Bird, that has developed the Food Justice Coalition, and it's called Food Fighters. And it's a combination of several different organizations that are working closely together as community advocates for this issue of food security. So this challenge at the basic level is so important to the viability of Albany, Doherty, and Southwest Georgia, but again, neighborhoods across the nation. Food is fundamental. Back in the 70s, we heard reading is fundamental, RIF.
Yeah.
But fifth, food is fundamental. So we hope that we will continue to spread the word about we need to get back to, if it wasn't God made, meaning from the ground or the trees or from the air, we need to minimize it. I'm speaking for myself, if you can see my visage, that we need to get back to more natural food consumption.
Yeah.
We do.
Absolutely. And I want to just say, first of all, that exhilarates me to hear that there are already organizations, who are sort of at the forefront of trying to solve these problems, because, that was the first thing that came to mind. I grew up in South Albany. And I remember going to Harvey's, and picking greens and peas, and so now when I go back home and I can't find the grocery store and I have to drive all the way out down Westover Road before we can get like a fresh bunch of greens, or I have to go all the way to East Albany, one of the questions in my mind is, how did this happen? Why did all the stores in this area close? And, I'm not sure, of course, we're talking about economic development and economic stability from a city standpoint in that context. But, I'm also an advocate, though, that we have to be our own saviors, in the sense that, Black farmers, bring your food to the community, please. How can we facilitate that? That was one of the things that we did in Chicago when I was there for my postdoc work, in the south side of Chicago, just what you described, that, people who lived in the hundreds, the south side, that's the numbers of the streets. So, the further south you get, the larger the numbers get. And they would have to get their foods from convenience stores. I remember in college at Albany State, we talked about staying on the perimeter of the grocery store, right? All the things that are in the refrigerated section, the frozen food, the fresh food, don't walk up and down the aisles. But when you go in a convenience store, there is no perimeter. Like, you have to take everything off the shelf. And so I'm very inspired and would love to support, these initiatives and amplify them however we can. But I'm also inspired that they're being run by, people within the community. We can't always rely on government initiatives to do the right thing anymore.
Absolutely.
We have to find solutions. I did have a question though for Dr. Adams Cooper.
Can you hold on to that question? We're going to take a quick little break, and then when we return from the break, the microphone's going to be in your hand, Dr. Davis, and you can pose that question to Dr. Adams Cooper.
Okay.
We'll be right back.